You're listening to Health Professional Radio with Wayne Bucklar. Today my guest is Mark Brooke. Mark is the Chief Executive Officer of Asthma Australia and joins us from Brisbane, Australia. Mark, welcome to Health Professional Radio.
Thank you, Wayne.
Now, Mark, Asthma Australia, I guess, is a not-for-profit association committed to asthma, but why don't you tell us the story?
So Asthma Australia is a national health charity that works through each state and territory's asthma foundation here in Australia, and our role is to support people with asthma so that they can reduce the burden of asthma on their lives or on the life of a person they're caring for. And our organisation is now over 50 years old, and we've been providing resources and support through a whole range of mechanisms to hundreds of thousands of Australians that have asthma.
Asthma's an incredibly common disease, isn't it?
Yeah, look, asthma impacts on roughly 1 in 10 Australians, or nearly 2.3 million people. And like all chronic illnesses, it has a far-reaching and profound impact. Even when it's mild, it impacts upon the lives of many Australians. It particularly impacts on the lives of Aboriginal and Torres Strait Islander Australians who are more prone to live with chronic disease, particularly respiratory illnesses. So I'm very conscious of the fact as an organisation that we need to focus in on Australians who are more vulnerable. So that includes Aboriginal and Torres Strait Islander people and those who live in rural and remote communities right across Australia as a continent.
And to some extent, for people who have never suffered from asthma, it often looks like a relatively minor ailment, but I think it can be life-threatening in some circumstances, can't it?
Yeah, that's right, Wayne. I think there are a couple of common myths about asthma as a chronic condition, and one certainly is that asthma impacts upon a significant proportion of the population. And whilst the majority of Australians, over 75%, will have mild asthma, we know that even mild asthma, poorly controlled and poorly managed, can result in heart-aching consequences. All too frequently, we know from hospitalisation records right across the country and from recent studies that many asthma deaths are preventable. And whilst asthma deaths in young children are quite rare, sadly, deaths in older Australians, those over 65, are quite concerning.
Well, I had no idea. I guess I'm not a clinician either, but Mark, 95% of our audiences are clinicians of one kind or another. We get both acute care and aged care as the commonest groups who listen to us. Is there a takeaway message for them that you'd like to get across today?
Look, yes, there's a couple of takeaway messages. I think asthma is treated in primary healthcare in the majority of instances. So GPs, primary healthcare nurses and pharmacists, and indeed our colleagues in aged care, have a really important role in understanding asthma and its comorbidities, COPD, bronchiectasis for children and so forth. So for us, it's really important that my take-home message to all health professionals is that asthma continues to be a significant burden on the lives of those whose asthma is out of control. And research released this year, a study called the Air Supply Study, has shown that there is a disconnect between health professionals' understanding of asthma, so patients being well and well controlled, and what the patient sees as being well controlled. And I've been privy to a number of studies and interviews where you can see a person with asthma will say, my asthma is well controlled, but when we apply the asthma control test, in fact, they're waking 2 or 3 times a night. They're overusing their reliever medications. They're not complying with their asthma management plan. And it's vital that our colleagues in primary healthcare absolutely adopt asthma management plans as best practice. Research is leading us down the road into phenotyping, and that asthma is not one condition, and that we would have targeted treatments and interventions, the right treatment at the right time for the right person. But that's some way off at the moment, Wayne, and I think, as a chronic illness managed in the community, GPs, pharmacists, nurses have a vital role in making sure that patients are self-managing the condition. My take-home message is if everyone was taking their preventive medications who were mild and moderate, we would see substantial reductions in asthma mortality and hospitalisations in Australia.
That's a significant message to try and get across, and I guess a common sense message, but clearly one that hasn't made it through to everyday practice. Look,
I am surprised. If we take the Australian Institute of Health and Welfare research, with the maximum number of Australians with an asthma management plan or an asthma action plan is 20%. Now, when we think about Australia having a world-class health system, a relatively high proportion of our population with good health literacy and access to affordable medications, we have, through our colleagues at the National Asthma Council, world-class asthma management guidelines, which say, number one, let's give every patient an asthma action plan and take the time to explain it to them. Now, when I was going to school and university, 20% was never going to be a pass mark. And I think we all need to lift our game, both as a not-for-profit in Asthma Australia, primary healthcare, and even in the tertiary health system. We need to lift our game and make sure that at least every patient has an asthma action plan that they understand, and that we take the time to explain why that's important and give people the skills necessary to manage their condition.
Mark, is there a common misconception that drives you nuts and keeps you awake at night?
I'm always surprised whenever I talk to political leaders or policy makers or even some of my colleagues in the health sector is that asthma is a thing of the past. Asthma's old, isn't it? And yeah, I think Australia has a remarkably proud track record in asthma mortality. The late 70s and 80s, when we were seeing significant spikes in asthma deaths around this country, the introduction of preventive medications, the introduction of guidelines has seen that number get below 400, and I think that's a really proud achievement for Australia. But the fact that we still have, and this is the contrast, this is the sort of contradiction I find in asthma, the fact that we have world-class first world health systems, access to medications for the majority of Australians, the fact that we have world-class guidelines, but still people are reporting poorly controlled asthma. So there is a disconnect there between the complexity of the problem and what's happening. And recently our colleagues in the research sphere have put out a call to action to change the way in which we think about asthma and how it's treated, and we endorse that. We think we need to, looking forward, move to the right treatment to the right person at the right time. But as a population, we need to do better. We still can't forget our population health and primary healthcare strategies that are, like immunisation or like heart or stroke, are vitally important in making sure that every Australian has access to the right and most appropriate care, particularly those with asthma.
Mark, it's been a pleasure having you with me today. Your passion for the topic is clear and ringing out, and maybe we can help dispel a little bit of that misconception with our audience as a result of having you on the program today. What's the best way for people to get more information?
Look, I think, Wayne, our website is one of the leading and most trusted websites in the world. We look at where people come from to the Asthma Australia website, and about 80% of our audience comes from within Australia, but 20% is scattered all over the world. So I think if people want to know more about managing their asthma or indeed working proactively with their patients, then I'd encourage them to go to asthmaaustralia.org.au or sign up for one of our either health professional newsletters or e-newsletters or research newsletters. That way we can keep in touch with you and let you know what's happening across the asthma and respiratory conditions sector. But recently we've just launched all of our patient-facing brochures as iBooks, and people can go to the iBook store and download a full suite of resources for free. And I watched a lovely process the other day where one of our ward nurses in a hospital had our material on her iPad and was able to walk a patient through a video on device technique then and there. And that actually is an unexpected advantage of the digital age. So by all means, I'd encourage people to look, if they work in the eye space, download those resources and give us their feedback. As an organisation, we thrive on constructive feedback, so I'd welcome that, Wayne.
Thanks, Mark. My guest today has been Mark Brooke, CEO of Asthma Australia. And if you've missed my chat with Mark, there's good news. We have a transcript on our website at www.hpr.fm, or you can listen to an audio archive of the entire interview on both YouTube or SoundCloud, and we have links to both of those on our website. My name's Wayne Bucklar. You're listening to Health Professional Radio.